morning, students. Good morning to all of you.
Good morning, ma'am.
So, due to network problem, I was unable to take your class yesterday. Okay, and there is the network connection is very poor. So, let it be. See what will happen today again. So, day before yesterday, I had told you about the structure of heart. Okay, and I had taught you the junctional tissues or the conducting system of the heart. That day we had seen it. So in conducting system of heart, we had seen that it consists of three parts. One is SA node, which is present just below the opening of this superior vena cava. Here is the inferior vena cava, and this is the SA node. That is sino-auricular node. Then this one is the interarterial septum. This interarterial septum. So here, AV node is present on this interarterial node, but it is present on right hand side. Okay, so this is AV node, that is interarterial node. Sorry, in atrioventricular node. Then from this AV node, bundle of His arises. That I had told you. This is bundle of His. Bundle of His. And this bundle of His, it divides into two branches. One will enter into the left ventricle and the second is enter into the right ventricle. And it will give rise to small fiber-like structure or branches, which we call it as a Purkinje fibers. उसे हम कहेंगे Purkinje fibers. Okay, do you remember this one? This SA node is called as pacemaker. Then AV node is called as pacesetter. Okay. Then why it is called as SA node is called as pacemaker? So that day I had told you. It forms its own contraction impulse. That's why it is called as first contraction center or the pacemaker. And it gets received by AV node, and that's why it is called as pacesetter or the second contraction impulse. It will receive the electrical impulses from SA node, and it will send it towards the bundle of His and Purkinje fibers. So do you understood this? Today we will see how the mechanism of this heart takes place. Okay, so here, as we had already said, right, this is the right atrium, this one is the left atrium, this one is the left ventricle, right ventricle. So this right atrium, it receives deoxygenated blood from superior vena cava, from inferior vena cava, and here one small coronary sinus is present. This is the coronary sinus. Through these, it will receive deoxygenated blood. As soon as the blood will enter into this right atrium, the three walls, that means here which wall I had told you. So here Eustachian wall is there, here Haversian wall is there, and here Hepatian wall is there. Again, in between right atrium and right ventricle, one wall is present, that is the tricuspid wall. That all walls, they will get closed. As they will get closed, So the blood will accumulate there. Hydrostatic pressure will create due to it. Okay, and due to that hydrostatic pressure, this SA node will get stimulated. As it will get stimulated, it will form its own electric impulse. As this electric impulses will so strong, so that will travel towards the left atrium also. In this way, this SA node, it will form the electric impulse. वो electric impulse form करेगा, which is travel towards the left atrium also. And because of it, both the atrium, they will get contract. Okay, so they will get contract at the same time. But here, this Eustachian wall, this Haversian wall, here the Haversian wall, these three walls, they are closed. And because of it, the tricuspid wall and the bicuspid wall, which is present in between right atrium and right ventricle and left atrium and left ventricle, they will open, and because of it, the blood from right atrium will enter into right ventricle, the blood from left atrium that will enter into the left ventricle. इस तरह से जो है तो blood आएगा. तो the contraction of heart, contraction is called as systole, and the dilation of heart is called as diastole. So here, during diastolic phase, during the dilation stage, or during the relaxation phase, we can say, तो blood will get filled, blood fill होगा उसमें, और जब contraction होगा, तो blood will come out, वहां से blood जाए, ठीक है? तो here, just now I had told you कि contraction हो रहा है, contraction की वजह से tricuspid and bicuspid wall they will get open, and the blood from right atrium that will enter into right ventricle, blood from left atrium that will enter into the left ventricle. As soon as the blood will come here, यहाँ पे क्या होगा? The contraction impulse which was started, so that will get received by this AV node, and this AV node, it will transfer it towards what? Towards bundle of his and Purkinje fibers, and because of it, the contraction impulses enter into the ventricle. So here, this tricuspid and bicuspid wall, they will get closed. As they will get closed, and the contraction impulse आ चुका है, then what will happen? So these ventricles, they will get contract. Ventricles contract होंगे, लेकिन ventricles contract होके blood कहाँ जाएगा? So blood will enter into the semilunar wall of pulmonary trunks or pulmonary aorta, and the semilunar wall of this systemic aorta. So they will open, and because of it, the blood will enter into this both aortas. Okay, so in this way, this mechanism process takes place in the heart. So here, this now the blood from this pulmonary trunk that will enter into the right and the left pulmonary artery, and from the right and left pulmonary artery, the blood, the deoxygenated blood that will enter into the lungs. There, the blood will get oxygenated, means oxygen will get mixed with that, and then the blood again come back towards heart in this left atrium. यहाँ पर जो है तो blood आ जाएगा through 4 pulmonary veins. Pulmonary veins जो है तो pulmonary veins के through blood कहाँ पर आएगा? Left atrium में आएगा, ठीक है? और उसी समय में जो यहाँ का लेफ्ट वेंट्रिकल का जो ब्लड था, तो वो ऑक्सीजनेटेड ब्लड था. So that oxygenated blood, it will reach to each and every part of the body except lungs. So as the each and every organ, they will utilize this oxygenated blood. So the blood will become deoxygenated, and this deoxygenated blood again come back into the heart. Into which part? So into the right atrium of the heart. Through the superior vena cava, inferior vena cava, and the pulmonary sinus. So in this way, this mechanism process takes place. So here, if you will observe properly, what you will see that here the oxygenated and deoxygenated blood that carries to each and every part, or they are running simultaneously, but there is no mixing of oxygenated and deoxygenated blood. So as there is no mixing of deoxygenated and oxygenated blood, so it is called as double circulation. We call it as a double circulation. This double circulation is present in our body. So what do you mean by double circulation? So just now I had told you the oxygenated and deoxygenated blood run into the body of human being without mixing with each other. So such type of circulation is called as double circulation. And in this double circulation, what we will see, so there are two types of circulation we will see here. One is pulmonary circulation, and the second is the systemic circulation. Systemic circulation. So what do you mean by pulmonary? Pulmonary, this word, it is always related with the lungs. ये lungs से related होता है, ठीक है? So when the blood will go into the lungs, so definitely that circulation is called as pulmonary circulation. Just now we had seen how the blood will enter into the lungs. So that will enter into the lungs by pulmonary trunk. है ना? So when the ventricle will contract, the blood from right ventricle that will enter into the pulmonary trunk. From pulmonary trunk, as soon as this pulmonary trunk comes out from the heart, it will be divided into right and left artery. This right and left artery, which consists of deoxygenated blood, that will carry this deoxygenated blood towards the right and the left lungs, where it will become oxygenated, and this oxygenated blood, it will come back to the such type of crossing is there. So it will enter into this left atrium. So this path is called as, this circulation is called as pulmonary circulation. So I am giving you in a systematic form the pathway of blood from right ventricle to left atrium via lungs is called as pulmonary circulation. And just now, how the mechanism takes place, I had told. Then second is systemic circulation. So systemic circulation, system, body systems. Okay. So when the blood from, when the ventricle contracts, so the blood from left ventricle, it will enter into the systemic aorta. This systemic aorta consists of oxygenated blood. This oxygenated blood, it will get supplied to each and every part of the body except lung, where it will become deoxygenated, and this deoxygenated blood come back into the right atrium of the heart by superior vena cava, inferior vena cava, and the coronary sinus. So this is called as systemic circulation. So the pathway of blood from left ventricle to right atrium. So in this way, crossing is there. From left ventricle to right atrium, higher systems of the body is called as systemic circulation. I hope you understood this one. Do you understood?
Yes, ma'am. Yes, ma'am.
So here, how when have you observed the doctor, when examine you, he put his stethoscope on your chest. So this is practical for us. So we have to count it, how much heartbeats are there, whether it is normal or abnormal. The normal heartbeats, they are 75 per minute. Normal heartbeat is 75 per minute. But what is heartbeat? So let's see. Actually, one systole and one diastole. One systole plus one diastole. Okay. That will make one heartbeat. One heartbeat. Or we can say it will complete one cardiac cycle also. Cardiac cycle. And to complete one cardiac cycle, 0.8 seconds are required. In 0.8 seconds, one cardiac cycle get completed. Okay. So here, one systole and one diastole, that means one heartbeat. तो देखो जब हार्ट जो है तो वो रिलैक्स कंडीशन है, ठीक है। जब रिलैक्स कंडीशन में है तो जो लेफ्ट साइड है अपना, यहाँ पर जो है, जो लेफ्ट साइड है, तो लेफ्ट साइड में पल्मोनरी जो वेंस है, वहां से लंग्स से जो है पल्मोनरी वेंस के थ्रू ब्लड एक्यूमुलेट हो जाएगा यहाँ पर आकर। और राइट जो ऑरिकल है, तो राइट ऑरिकल में कहाँ से ब्लड आया, तो सुपीरियर वेना कावा है, ये इंफीरियर वेना कावा है, यहाँ पे कोरोनरी साइनस होता है, तो यहाँ से डीऑक्सीजनेटेड ब्लड आएगा। देन these auricles, they will be in a relaxed condition. जब वो रिलैक्स कंडीशन में है या डायस्टोलिक पोजीशन में है, तो यहाँ पर रिपोलराइजेशन होता है, यानी ब्लड जो है वो एक्यूमुलेट हो, ठीक है। तो दिस इज द डायस्टोल ऑफ ऑरिकल्स, ये डायस्टोल हुआ ऑरिकल्स। तो जब ऑरिकल्स का डायस्टोलिक पोजीशन होती है तो उस समय में वेंट्रिकल्स जो है वो सिस्टोलिक पोजीशन में होते हैं, यानी कॉन्ट्रैक्शन होता है। जब कॉन्ट्रैक्शन होता है तो डीपोलराइजेशन होता है। डीपोलराइजेशन होने तो जो ब्लड है तो दैट विल गो आउट, वो बाहर जाए, ठीक है। तो यहाँ पर इनका ऑरिकल्स का एक सिस्टोल एक डायस्टोल, वेंट्रिकल्स का एक सिस्टोल एक डायस्टोल। जब ये कॉन्ट्रैक्ट होते हैं तो मैंने जैसे अभी बताया था कि ट्राइकस्पिड और बाइकस्पिड वॉल ओपन होके ब्लड जो है तो दैट विल फिल इनटू द राइट एंड द लेफ्ट वेंट्रिकल्स। यहाँ पर जो ब्लड फिल हो रहा है तो दैट, तो डेफिनेटली दैट कंडीशन विल बी डायस्टोलिक पोजीशन, वो डायस्टोल रहेगा किसका, वेंट्रिकल्स, ठीक है। तो वन सिस्टोल एंड वन डायस्टोल, that will make one heartbeat, or it is also called as one cardiac cycle. And to complete one cardiac cycle, 0.8 seconds are required in 1 minute. 1 मिनट में जो है तो यहाँ पर 75 हमारे हार्ट बीट्स होते हैं, या 75 कार्डियक साइकिल हम कंप्लीट करते हैं। नॉर्मली फिर हम जो है तो इट में भी प्लस और माइनस, ये प्लस माइनस हो सकते हैं, तो दैट्स व्हाई वी टेक इट एज अ 70 to 80 per minute. This is the normal range. ये नॉर्मल है, बट द एग्जैक्ट विल बी 75 पर। तो यहाँ जो है जस्ट आई हैव टोल्ड यू कि डॉक्टर एग्जामिन विद द हेल्प ऑफ स्टेथो, तो व्हाट दे ऑब्जर्व और व्हाट दे हियर, वो क्या सुनते हैं, तो दे हियर द हार्ट साउंड। अब ये जो हार्ट साउंड है तो कैसे प्रोड्यूस हुआ, तो व्हेन ट्राइकस्पिड वॉल एंड बाइकस्पिड वॉल जब क्लोज होती है तो दैट टाइम वी कैन हियर द फर्स्ट हार्ट साउंड। हार्ट साउंड जो है तो हमको पहले सुनाई आता है, जो कि लब, ऐसा लब। एंड व्हेन these semilunar valves they will get closed, so that time we will hear the second heart sound, and that second heart sound is dub. So here continuously lub dub, lub dub, like that we can hear the heart sound. Okay, so if it is in a synchronous manner, so definitely the position of our heart or the circulation which is going on in our body, That is the in a normal condition. वो normal condition में है ऐसा consider किया जाए. Do you understood beta? All of you?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So this is the normal functioning of heart or the mechanism of heart. But sometimes what will happen? There may be some changes occur in the pathway. यहाँ पर जो है तो जो pathway है उसमें कहीं ना कहीं कुछ ना कुछ चेंजेस हो सकते हैं. मे बी ब्लड सप्लाई नहीं हो रहा है या मे बी वहां पर जो है तो क्लॉट हो चुका है या कुछ भी हो सकता है. थ्रोम्बस फॉर्म हो चुका है. तो इस वजह से जो है हमारे हार्ट बीटिंग्स पे असर आएगा एंड डेफिनेटली इट विल अफेक्ट आवर हेल्थ आल्सो. तो हमारी हेल्थ पे भी अफेक्ट करेगा. तो we will study these heart diseases. Yes, tomorrow I will explain you. Today I am teaching you the blood pressure. तो यहाँ पर just now I had told you कि when the ventricles will contract, this semilunar valve, both the semilunar valve they will get open, and through this left ventricle, the blood will enter into systemic aorta. From systemic aorta, this systemic aorta it will give rise to so many branches, and they are the arteries, and these arteries they will provide oxygenated blood to each and every organs. है ना? So when this blood it flows through this artery, so that time it will exert pressure. वो pressure exert करता है, or we can say it will exert force on the wall of arteries. जो arteries की walls होती है उसके ऊपर में वो pressure create करता है, and that pressure is nothing but the blood pressure. So our next topic is the blood pressure. So just now I had told you the definition of blood pressure. What is blood pressure? The pressure exerted or the force exerted by blood on the wall of arteries or on the arterial wall, we can say. So that is called as arterial blood pressure. This arterial blood pressure, they are of two types. One is systolic blood pressure, and the second is the diastolic blood pressure. Just before a few minutes, I had told you what is systole and what is diastole. Systole means contraction, diastole means dilatation or the relaxation. So when the ventricles will contract, that time the blood will flow into the arteries, and at that time, if the force is exerted by blood on the wall of the arteries, then it is called as systolic blood pressure. The normal systolic blood pressure is 120 mmHg. What is mmHg? It is the unit of pressure, millimeter of mercury. Okay. Then diastolic blood pressure. What do you mean by diastolic blood pressure? So when the ventricles will be relaxed, that time also again the pressure is or the force is exerted on the wall of the arteries due to this blood. So that is called as diastolic blood pressure, and this diastolic blood pressure, it is 80 mmHg. Okay, so we can say normal blood pressure is 120 by 80 mmHg, millimeter of mercury. Okay, the difference between the systolic and the diastolic blood pressure is 40 millimeter of mercury. This is called as pulse pressure. This is the pulse pressure. Okay. Now, let's see about the high blood pressure or the hypertension. So, what do you firstly we will see is there are some factors which are responsible for this blood pressure. So, what are that factors? वो factors क्या हैं? तो सबसे जो normal factors हैं, as per age, जैसा हमारा age बढ़ेगा, तो blood pressure will increase. ठीक है? Then positional. If we are lying down, the blood pressure will be less. Then in a sitting position, it will quite increase. In a standing position, it will again increase. During exercises, if you are running or you are doing any exercises, so that time definitely it will get increased. So as I had told you, as per age, it will increase. In old age, definitely it will increase. What is the reason? Because the elasticity of blood, elasticity of blood vessels, that will get reduced. अब वो reduced हो रही है तो definitely the flow of blood will get restricted. इसकी वजह से जो है तो हम लोगों को क्या दिखेगा कि यहाँ पर blood pressure increase होते हैं. ठीक है? वैसे ही अगर if we are in a tension, in a stress condition, so that time definitely the blood pressure will increase. उसके बाद the abnormal जो रहेगा, the abnormal may be due to kidney diseases, maybe due to changes in the means if the hyperthyroidism will be there, so that time the blood pressure will be low, and in hypothyroidism the blood pressure will be. After that, if we are getting suffer from atherosclerosis or arteriosclerosis like diseases, so that time again the blood pressure will increase. तो ये जो है ये सब कुछ factors जो और जो पर्सन बहुत ज्यादा फैटी डाइट लेता है, जिसकी बॉडी में कोलेस्टेरॉल लेवल इंक्रीज हो चुकी है और इसमें भी हेरिडिटी कुछ ये जो है तो हेरिडिटरी भी है. If your parents or grandparents they are suffering from hypertension, so you may get suffer from hypertension. तो ये फैक्टर्स हो गए. लेकिन हम हाइपरटेंशन तक कहें, ये हाइपोटेंशन तक कहें, तो लेट्स सी कि when the blood pressure the normal blood pressure we had seen, that is 120/80. So when the systolic blood pressure will be 140 or more than that, and the diastolic blood pressure will be 90 or more than that, so then this condition is called as hypertension. Okay. Similarly, when the systolic pressure will be 100 or less than that, and the diastolic will be 70 or less than that, then that condition is called as hypotension. Hypotension का मतलब होता है low blood pressure, hypertension का मतलब होता है high blood pressure. ठीक है? तो यहाँ पर जो है, how can we will measure this? So we will measure this by instrument. In simple language, we call it as Bpa Apparatus, and the scientific name of it is sphygmomanometer. Sphygmomanometer, ये जो वर्ड है, तो ये स्पिग्मॉन वर्ड जो है, तो the meaning of this is the nanometer measuring device. So it is the pulse measuring device, and we measure mostly the we measure blood pressure of brachial artery. The brachial artery it is present near this elbow. So this is the median part, this is the lateral part. Okay, so here just below this elbow joint, sorry, just above this elbow joint, if you will press like this, you can feel the pulsation. So that pulsation, they are of brachial artery. ये जो pulsation है ये brachial artery के हैं, जिसका हम blood pressure मेजर करते हैं, ठीक है। अब देखो कि ठीक है, हमारे हाथ है तो हम हाथों का जो है तो ब्लड प्रेशर लेंगे। If any person comes to you and they don't have hands, then उसके हाथ नहीं है, like a ठाकुर in शोले फिल्म, शोले फिल्म देखी होगी आप लोगों ने, जिसमें ठाकुर के दोनों हाथ नहीं है, and that ठाकुर will come to your clinic and we have to take a blood pressure. So possible to take blood pressure? Yes, anybody will answer me? Is it possible for us to take blood pressure from that person? Anybody? Yes or no? No one wants to answer. तो ऐसे कंडीशन में भी हम ब्लड प्रेशर ले सकते हैं डेफिनेटली। यहाँ पर जो है तो we have so many arteries in our body. So that time we can take the blood pressure from the lower legs. Lower legs से जो है तो blood pressure ले सकते हैं. But why we take a blood pressure from the brachial artery? Because it is the convenient. It is the convenient side so that we can take a blood pressure from the patient, and that's why most probably we choose this brachial artery for the blood pressure. So how to take blood pressure, that is in our practical, that we will see later on. Okay, so this is about the blood pressure. Do you understood?
Yes, ma'am.
Okay. Now here what is the difference between the pulse and the heart? So just now we had seen about the heartbeat, one systole and one diastole that make the one heartbeat. Then what is pulse? So pulse, when the blood flows, that time the wave will form, and that wave is nothing but the pulse. वो जो wave रहती है उसी को हम pulse कहते हैं. But always remember the pulse rate and the heart rate, that will always similar. That means what will be the pulse rate? So the pulse rate is 75 per minute. Pulse rate हमेशा कितना रहेगा? तो 75 पर मिनट ही रहेगा, क्योंकि हार्ट बीट भी 75 पर मिनट. So but if we see any changes in the heartbeat and the pulse rate, अगर pulse rate और heartbeat में कुछ changes दिख रहे हैं, so that means we may have some problems regarding the circulatory system. यहाँ पर जो है तो pulse rate, normal pulse rate is 75 per minute, but it may get increased or decreased. Okay, so if the pulse rate will be increased, then that condition is called as tachycardia. And if the pulse rate will be decreased, then it is called as bradycardia. और अगर मुझे किसी ने पूछा कि what is tachycardia, and if I am answering when the heartbeat will be increased, then it is called as tachycardia, and when the heart rate is decreased, then it is called as bradycardia. So am I wrong? No, I am right, because the same term is given for both pulse rate as well as heartbeat. So when the heartbeat will increase, then it is called as tachycardia. Then the heart rate is decreased, then it is called as bradycardia. Now I am observing one thing in this pandemic situation. Most of the persons, they are having this tachycardia. As they are so much thinking, बहुत ज्यादा सोचते हैं, नींद नहीं आ रही है, तो मोस्ट ऑफ द पर्सन्स दे कम टू मी, मैडम बहुत ज्यादा ना जैसे घबराहट हो रही है और हार्ट बीट्स जो है तो बहुत ज्यादा बढ़ गए हैं, ऐसे वो भी बताते हैं। तो नॉर्मली हम हार्ट बीट्स हमारे फील नहीं करते, बट व्हेन इट विल बी इंक्रीज्ड, दैट टाइम we can feel it. So that condition is called as palpitation. जब हम फील करेंगे हमारे हार्ट बीट्स, that is called as palpitation. तो ये palpitation जो है most of means most of the patients which I am daily treating, most of the persons they are having tachycardia at this time, maybe due to tension, maybe due to economical problem, or
हम साउंड प्रॉपर नहीं आ रहा है।
but maybe due network problem is there. Is it okay now?
Yes, ma'am.
So much network problem is there. That's why yesterday also I had not taken your class. So here, when we will feel our heartbeat, so that condition is called as palpitation. And palpitation may be there as the age will means due to old age, जैसा जैसा हमारा age बढ़ता है, so that time during menopausal age of woman, so we can feel palpitation. We may have palpitation, or maybe due to some tensions, stress condition, so palpitation may be there. Palpitation रह सकता है। क्या अगर हम किसी डॉक्टर के पास में जा रहे हैं तो डॉक्टर क्या बताएगा, हमें कोई डिसीज तो नहीं हुआ है। तो इस तरह से अगर हमारे माइंड में फील आता है, या फिर हमको जब डर लगता है, फियर फ्राइड जब रहेगा, तो दैट टाइम आल्सो द we can see the palpitation. The palpitation thing. Do you understood? Do you understood all these things?
Yes,
Okay.
ma'am.
So we had seen most of the normal things here. Now we have to see the abnormal thing. So can I take it tomorrow? There is a network issue also, and my son is having his examination.
Yes, ma'am.
Tomorrow I will tell you few diseases which are given in your syllabus, and then we will take the new topic. So today I will send clips of this heart to go through it and study. Okay. Thank you, Beta.
Thank you,
Thank you,
ma'am.
ma'am.
Thank you, ma'am.